Well, for more on the pandemic and mental health, I spoke with Dr. Wendy Dickinson. She's a licensed psychologist and the founder and CEO of Grow Counseling. And she began by describing the target audience for mental health startups.
Well, I think there are two things that really have come out of the pandemic. One is just normalizing reaching out for mental health support. I think the media's done a great job of talking about that, and I think people in general are talking about it. So we've seen an increase in the number of people that are looking for therapists. So there are a number of apps that are kind of like matchmaking services. Psychology Today, The Right Counselor, they help you find a therapist that would be a good fit for you.
And what about helping those most affected by COVID? Are we seeing more mental health services being offered to, say, frontline workers, COVID patients, nursing home residents and such?
We absolutely are. Another great thing that's come from the pandemic is that a lot of the telemental health laws, those that govern how we practice through video conferencing and maybe by telephone, have been relaxed. And so a lot of these services are easier to provide to people who maybe have just gotten off of a shift or aren't in the same location as a therapist who specializes in what they need. And so we're seeing a rise in people doing more video conferencing, which is really great. And
you mentioned that, about resources being easier to find. Are there enough trained professionals out there to support this demand?
I think it's a good question. Many of the therapists that I know are approaching a full caseload if they don't already have a full caseload. But that doesn't mean that there aren't therapists out there to help. One of the things that I think is really important to understand when you're reaching out for healthcare is mental health care is what kind of therapist or professional are you trying to connect with? If you think about the medical industry, you may see a nurse for something, a physician's assistant for a different thing, a general doctor or specialist. In the same way, in the mental health field, you may be able to get in with somebody who has a certification, but then you may need to bump up to somebody that has a master's degree or a PhD or a medical degree. So it depends on what you're needing and finding somebody who can best help with those needs.
And as you mentioned, there are a lot of options out there, from psychologists and licensed counselors to therapists and life coaches. What should people know about these options so that they can pick the ones that best suit their needs?
There's three things that I usually tell people. One is ask your friends. Usually, many of you have friends that already have a therapist and they can make a great referral for you. But if you don't, the first thing is to educate yourself. So understand the difference between a certification and a master's degree or a PhD, an educational degree, and the difference between that and being licensed. The third thing is to do your research. You can go onto your Secretary of State website and you can see if somebody is licensed in the state in which you live. You can also look them up online at some of these sites that we're talking about, the startup sites, to see what they specialize in, how long have they been practicing. Maybe read some of the blogs they've written to get a sense of what their voice is and what it might be like to speak to them.
Now, access is one thing, but even pre-pandemic, one of the biggest concerns about therapy was cost. How can some of these new platforms help with not just accessibility, but affordability? And is that even a focus for them?
I think one of the things that's interesting is when you take away some of those overhead costs, people are able to practice at a lower rate. The other thing is some of the sites that we're seeing are offering shorter sessions. So maybe they're more specific, or they're in a platform that's more like text messaging or emails. And so you can charge a different rate for that. Another thing that I've seen that I think is really fantastic is that low-cost counseling centers typically only serve one community or the area that they're in. And because of the telemental health laws changing and generally access around video conferencing, those low-cost treatment centers are able to offer services far more widely.
And I want to talk about provider diversity, because overwhelmingly it is a white-led industry in terms of the actual providers. And you have mental health startups like Ayana that were designed to better identify with some of the more marginalized communities and some of their specific issues. How much of a focus is that for some of these mental health startups that you're seeing?
I think that focus is beginning to roll. I think we absolutely are going to need to see more of those as we move forward. As you said, it is often a white-led industry, white-dominated industry, and there's a desperate need for diversity for people of color, not just on the therapy side, the therapist side, but also in terms of the people that are leading the startups.